An intervertebral disc is a structure that sits between the bones in your spine. I like to think of it as a jelly-filled donut. You have an outer crust and an inner portion filled with jelly. Over time, if you place pressure on this structure, you can develop cracks in the crust, and that can contribute to pain. If those cracks get big enough, some gel can leak out, and that's what I would describe as a herniated disc. So typically with herniated discs, these can occur gradually with time with age-related changes. Sometimes they can occur with a sharp increase in pressure or a sudden movement, such as when you're bending over or you're doing something that involves twisting. I can't count how many times I've had patients come in talking about how they just reached over to put on a sock in the morning and they had a herniated disc, or they helped their friend move and they lifted something heavy and they threw out their back. These are all likely herniated disc issues. We typically treat disc issues with a combination of physical therapy, non-steroidal anti-inflammatory medication, and if needed, injections. When it comes to physical therapy and what we can do to prevent herniated disc, we typically encourage patients to try to activate their core or work on core strengthening, as well as kind of optimizing their posture when they're sitting for a long time or when they're gonna lift something. Sometimes if a disc gets really big, it can actually encroach in the space where the nerve comes out, and that's what we call sciatica. With that, we typically would recommend coming in for an evaluation. We can talk about other treatment options for that, as well as injections for that.